Hey there, Christophe from the French Herbal. This is the second part of my presentation on the health benefits of the pomegranate tree and the pomegranate fruit. In the first part, I explained to you that I wanted to do a quick research session based on some feedback I had obtained from a few people in my private practice, and I ended up sifting through a massive amount of information. So I decided to split the discussion in two. In the first part, I presented the traditional properties taken from classic herbal books, and in the second part, we're going to talk about properties and indications based on studies that have been conducted in the last 25 years. You'll see that it's a very promising tree and fruit and relatively easy to grow, especially in southern regions with lots of sunshine. I'll give you the full list of properties. You'll see it's quite extensive and everything is documented on my website. If you would like to get all the information without having to take notes, plus all the scientific references, go check the website. Before we begin, let me remind you that I'm neither a doctor, nor a pharmacist, nor a healthcare professional. I'm here to share with you some useful information about herbs, but this is in no way a substitute for a medical follow-up, and it's not intended to provide diagnosis or medical treatment. Okay, so let's talk about the properties and indications of pomegranate based on studies. And I'd like to highlight two key properties that form the foundation for everything else. You'll see that we'll be talking a lot about prevention of certain chronic degenerative diseases. And this effect is due to the antioxidant and anti-inflammatory properties of pomegranate. Let me explain. So today, inflammation and oxidative stress are major contributors to many diseases. And it's important to understand that these two phenomena are part of normal physiological functioning, right? So inflammation is necessary to repair tissues and for healing. Oxidative stress is used by our white blood cells, for instance, to destroy intruders. And some is generated by our mitochondria, the little power plants of the cells that produce ATP. And along the way, they release free radical in that process. Everything is fine as long as inflammation has a beginning and an end, and as long as we have enough antioxidant reserves to buffer that oxidative stress. But when these two phenomena become chronic, when inflammation becomes persistent, when free radicals attack us beyond our antioxidant reserves, well, over time, they cause tissue damage that can lead to chronic degenerative diseases or maybe worsen them. Sometimes they're not necessarily the trigger of disease, but they could be more like adding fuel to the fire, right? And as always, I'll put all the references on my website if you would like to check them. To benefit from pomegranate's effect, the best approach is to regularly integrate it into a healthy diet for prevention. Now, pomegranate may also have interesting applications when health problems have already appeared and start to be symptomatic. However, we lack solid data on those approaches, in terms of what form, what dosage. So we're mostly going to talk about the fruit integrated into a prevention program, right? Consumed regularly over the long term in order to vary dietary sources of antioxidant and anti-inflammatory substances. One thing seems clear to me: pomegranate is very well positioned as a superfood for protection against the so-called diseases of civilization. But what diseases exactly? So first, metabolic syndrome and the risk factors associated with it. Metabolic syndrome is something that affects a large portion of the global population today. And at the cellular level, it is characterized by insulin resistance associated with hyperinsulinemia. And In simpler terms, the cells no longer allow glucose inside of it. So glucose remains in circulation. The pancreas secretes extremely high levels of insulin and in an attempt to compensate for this cellular limitation. So we end up with both high blood glucose and high insulin levels, especially following meals, right? So two problematic factors that have long-term negative consequences. This syndrome is associated with high blood glucose, sometimes elevated total cholesterol and LDL, low HDL, accumulation of intra-abdominal fat with adipose tissue developing not just under the skin, but deep around the digestive organs, and sometimes inside organs such as the liver. Blood pressure may be elevated, and sometimes these parameters are only slightly out of range, but enough to signal a warning. And here, pomegranate appears to act globally on metabolic syndrome. Of course, drinking large quantities of pomegranate juice while continuing to eat a processed high glycemic diet, not exercising, sleeping poorly, etc., well, that would be pointless. But within the context of major lifestyle changes, then pomegranate is worth keeping in mind as a tool. Here's what has been validated by clinical studies with results observed using various forms like pomegranate juice, dry extract, juice combined with probiotics, etc. Several studies were conducted in Iran, the United States, Spain, and Israel. So findings include reduction in blood pressure, reduction in blood glucose, reduction in blood lipid levels, especially triglycerides, LDL cholesterol, and total cholesterol, stabilized adiposity, improved cellular sensitivity to insulin at the cell level, which is really the central issue here. So the scientific literature seems relatively solid, and I'll link to a systematic review on my website that summarizes all of this. As for quantities used in the various studies, they generally range from 120 to 240 milliliter of juice, so essentially 1 to 2 fairly large glasses per day. In one study, 45 milliliter of concentrated juice was used. In another, slightly more, like 330 milliliter, but most of the time, the researchers tested between 120 and 240 milliliter. From a cardiovascular protection standpoint, we already mentioned the impact on elevated cholesterol and lipid levels, but another very interesting point is that pomegranate protects against oxidation of LDL. And LDL oxidation appears to play a major role in the development of arterial plaque, right? So LDL is a transporter that carries cholesterol, triglycerides, and fat-soluble vitamins throughout the body. It's like a little taxi, right? It plays an important role. But certain LDL particles, especially the small ones, they can infiltrate through the endothelium into the arterial wall when it is damaged due to poor lifestyle habits, due to maybe high blood pressure. But so once it's trapped inside the arterial wall, this LDL can oxidize, meaning that it is damaged by free radicals. And then macrophages will try to clean them up, but they struggle to do so. And they become what we call foam cells, filled with fat, which accumulates in the arteries. Then calcification will occur to stabilize this problematic layer, and so on. It's really a vicious cycle. So certain natural substances protect LDL from oxidation, slowing down this process. We know that green tea does that, hibiscus, rosemary, garlic, olive leaf, etc. You can now add pomegranate to the list. The third notable property is actually related to the first one we discussed, non-alcoholic fatty liver disease, right? This is a fatty liver caused by metabolic disorders. So here, alcohol consumption is not the cause. Sometimes medication are involved, but most cases really stem from metabolic troubles. And here we have studies that looked into pomegranate preparation. So first we had a pomegranate peel extract, and we're talking about the fruit peel, right? Not the tree bark, which is toxic, as I explained in the first episode. So the peel extract was dosed at 1,500 milligrams per day for 8 weeks, combined with lifestyle and dietary advice. And the same advice was given to the placebo group as well. The peel extract led to a significant reduction in liver stiffness and the degree of hepatic steatosis. We also have an animal study, therefore less reliable for human application. But the interesting point here is that pomegranate flower extract was used in that study, which is also rich in antioxidant, and it improved hepatic steatosis as well. Hey, just a quick pause to let you know you can grab my free ebook on preparing herbal teas for the 4 seasons. It's full of simple recipes and blends you can make with herbs you can buy or even grow almost anywhere. The link is right below this episode. Go check it out. Pomegranate extract has demonstrated neuroprotective effect thanks to its antioxidant and anti-inflammatory properties again. So researchers use the term inflammaging, meaning cellular aging caused by chronic inflammation, particularly aging of the brain and nervous system. And here the number of studies is a bit too large to summarize, so I'll mention a review that focused on that topic. Most of the studies were animal or in vitro research, so the results should be interpreted with caution for human relevance. But for Alzheimer's disease, there is neuron protection, slowing down of amyloid plaque formation, improved synaptic activity, that is the ability of neurons to transmit signal, slowing cognitive and memory decline. For Parkinson's disease, we have improved survival of certain neurons, better neuronal protection, improved motor and olfactory activity, meaning better movement and better smell. So all of this seems to be very promising for neurodegenerative diseases, but we still have very little data on human use, right? At a minimum, pomegranate seems highly relevant in the prevention program for these diseases, especially for individuals that are at risk, maybe from a genetic perspective. Right? Of course, this is not a claim or a promise. Regarding cancer, again, a lot of in vitro and animal data, making it difficult to draw clear conclusions for humans. However, pomegranate appears to act on several mechanisms. It induces apoptosis in cancer cells. It blocks their cell cycle. It blocks certain signaling pathways involved in cancer progression. So overall, a very good fruit to consume regularly in a preventive approach against cancer. We have in vitro data suggesting protection against prostate, breast, and bladder cancer. For prostate cancer, we have a few human studies. You'll find the references for a review on my website. The conclusions are mixed and unclear. Some studies show positive effect and others do not. In one study, after intervention for prostate cancer, the PSA doubling time, and that is the time needed for PSA levels to double, was longer in men who took pomegranate extract than in those who did not. So the doubling time reflects the tumor growth rate, so which was slower thanks to pomegranate. Overall, it seems to be that the balance leans toward benefits for prostate cancer. In any case, after reviewing all these studies, I think I'm going to start consuming pomegranate juice on a regular basis for prevention. We have quite a bit of data on the benefits of pomegranate for oral health. A review shows that pomegranate extract is more effective than a broad-spectrum antiseptic for gingivitis. And yet, when we look in vitro, that same extract is not very effective at killing the pathogens responsible for gingivitis. So how do we explain this? Well, the review shows that pomegranate does not directly kill the pathogens, but it acts on its aggressiveness, right? So it doesn't kill the bacteria, but it prevents it from spreading too fast. We also have a clinical study in which pomegranate extract was used to disinfect the area before a procedure for pulp necrosis, that is the death of the tissue inside the tooth. Regarding skin health, we have data suggesting that pomegranate is highly active against acne. And a broad spectrum of action has been observed. Reduction in the amount of bacteria involved in acne, reduction in the formation of keratin contributing to blackhead formation, reduction in lipase activity, which is the enzyme used by bacteria to break down sebaceous secretions and to use them for growth. So this is a fairly broad action, which could lead to facial products maybe based on powdered pomegranate peel extract or decoction of pomegranate peel applied to acne maybe, or perhaps diluted juice preparations. Given pomegranate's antioxidant and cell protective effect on the skin, we also have studies positioning it as anti-aging, although that term very quickly leads to overhyped marketing claims, as you can imagine. Several studies suggest that pomegranate may help to relieve menopause symptoms. However, a systematic review notes that these studies often lack randomization, they lack double blinding, they have a small sample size, etc., etc. That being said, it may be worth trying, right? And if you have any feedback on the subject, feel free to share it in the comment section on my website under the article associated with this episode. If you used it for menopausal symptoms, did it help or not? And we'll finish with a few more properties demonstrated mainly in vitro. Pomegranate appears to be a potent antibacterial and antifungal. Antibacterial against Staph aureus, E. coli, Enterococcus faecalis, etc. One interesting point is that pomegranate inhibits Helicobacter growth. It reduces its adhesion to the gastric mucosa, and it calms stomach inflammation. So it's worth considering for anti-Helicobacter programs. It is also antifungal against Candida and other type of fungal infection. And those fungal infections can become problematic when immunity is low, so that might be an interesting tool to add to your toolbox. And that wraps up this extensive overview of pomegranate. In the first part, we covered traditional indication. In this part 2, we covered new potential from scientific studies. And really, it's hard not to find a use for pomegranate, especially in a prevention program against major diseases of civilization. In any case, it makes me want to plant a few trees in my garden. Thanks for listening. I'll see you soon for the next episode of The French Herbal.